Now at 6, an exclusive 5 on your side investigation that is prompting action by Ohio lawmakers. It could affect how your loved ones are taken care of in hospitals across the state. We first told you about nurses who become either too sick or too exhausted to be on the job.
5 on your side, Chief Investigator Ron Regan joins us live now. And Ron, what you uncovered could lead to a new state law protecting nurses and patients.
Well, we found nurses can be compelled to work far beyond 3 12-hour shifts, unlike airline pilots or truckers, both tightly regulated due to safety concerns and fatigue. Now, our report resulted in this new legislation.
I think what you're finding in your reports is what I found is that this is a sensitive issue in nurses across the entire state.
State Representative Robert Sprague is the primary sponsor of House Bill 456, legislation that bans mandatory overtime for nurses. Overtime that our investigation found can cost lives.
Tonight, an exclusive on your side investigation. Ohio nurses either too sick or too exhausted to be on the job, and these are the people caring for you or your loved one.
We started dating in '92, got married in '99, but she was the most compassionate person.
Compassion led Beth Jasper to nursing.
Would do anything for anybody.
And it may have cost her life.
A mile and a half from our house, she fell asleep.
Falling asleep may have caused this early morning crash.
The vehicle had flipped and she was gone. She was gone.
Beth was coming home from another round of overtime. Was she often fatigued?
All the time. All the time.
Was she often overworked?
Yeah. Yeah.
And long hours and fatigue are harming patients as well. Records obtained from the Ohio Nursing Board reveal one nurse administered Coumadin, a blood thinner used to prevent clots, without waiting for test results. In another case, it was given to the wrong patient. The same nurse also failed to give a patient a vital drug used to control seizures. She blamed overseeing 20 patients with potentially life-threatening conditions, and 12-hour shifts may have been too much for her. Others complained of being sleep-deprived and fatigued from excessive amounts of overtime. Someone could be seriously harmed. Someone could die.
Yeah. Oh, yeah. Absolutely. I've seen it.
This nurse remembers what happened one night on her shift.
And they don't often know that the reason that we couldn't do anything was because we didn't have the capacity to do it. And it's just horrible.
We're finding that it has struck a nerve, and the practice is more common than a lot of people would have originally thought.
I can't thank you enough for covering this report.
The Ohio Nurses Association believes it will save lives.
We need to be providing safe care, and we need to take steps to make sure we're doing that.
We'll be tracking this legislation in the coming months, and if passed, Ohio would join 18 other states banning mandatory overtime. The Ohio Hospital Association does not support it. I'm 5 on your side, Chief Investigator Ron Regan.